summarize the things which are about the descending tract. Not actually summarize, I've just made easier way to describe this, the descending tracts. First of all, we will discuss about the corticospinal tract. The corticospinal tract are responsible to take the function. What is the function of the corticospinal tract? That they are for the rapid skilled movements. Rapid skilled movements means that, for example, that very rapidly you have to send the signals downwards to the muscles or to the area or wherever you have to perform the function. To very rapidly, voluntarily you have to send the signal. This pathway is responsible for that. So corticospinal tract. And corticospinal tract, how it would be presenting over here. Let me make a little diagram of that, so it might be easier for you. So what are these? These are thalama, and what is this? Internal. From here it will be going to the internal capsule, and the internal capsule, these are going to this pathway, and they will be dispersed, and after dispersion they will be crossing over, and they will come down, and then they will be going downwards. Okay, did you get that? These are dispersed, and the nucleus is also present over there, which nucleuses are called as the pontine nucleus. Okay. So from where, what would be the origin of that? What would be the origin? There would be the primary cortex. The primary cortex would be the origin. You remember here the primary cortex. So primary cortex is the actual origin. That area 1 and area 4 and area 6. We will discuss that thing, but up to now you have to know that thing. Now the next thing is that what is the site of crossing? The site of crossing would be that the decuscation of the pyramids. You remember the pyramids here? So the decuscation of pyramids are the sites where they will be crossing over. And what is its destination? What is its destination? Its destination is the internal nuclei nerves of the alpha and the motor neurons. Alpha motor neurons are its alpha motor nucleus actually. Alpha motor nucleus is its actual actual destination where it would end. You remember the alpha motor alpha and the gamma nucleus is present in the anterior horn. Yes, remember? So the decision would be going over there. You were at that time asking that either it could go over there or not in that lecture. So that the answer is that it can also go at that point, specific point. So the corticospinal tract, the origin it becomes from the primary cortex, and from the primary cortex at the site of the crossing, which is the decuscation of the pyramids, and their destination is to the motor nucleuses. And how they are they giving the branches? Yes, they are giving the branches to the red nucleus. They are also giving the branches to the olivary nucleus, or they are also giving the branches to okay, this is just enough. The interior nucleus, these are also giving the branches over there, and these are also giving branches to the cerebellar cortex. Okay, so what is the red nucleus, what is the olivary nucleus, and what is the cerebellar nucleus? We will discuss this thing in this lecture. Even we will discuss that thing, and we will come back again at this point. What is the red nucleus, what is the olivary nucleus over here, and then what is its function? It will innervate, or it will provide the rapid functioning. It will be giving the rapid movements or the voluntary movements. Okay, so the corticospinal reticulospinal tract is the most effective pathway and the most rapid pathway, we can say, that is coming, that the origin is the primary cortex, and when it will come down into the internal capsule. After it will go down at the level of the medullary pyramids, this will be dispersed, and when they will form that pyramids, they will come down and they will be decussated, or like they would be crossed over there, and the destination would be the alpha motor neurons, which we talked about in the anterior gray matter, and the branches they are giving to the red nucleus, olivary nucleus, and the cerebellar cortex present over there, and its function is to perform the rapid movements and also the voluntary movements. Okay, this is one thing. So this is the pathway for the corticospinal tract. Okay, now we will talk about the reticulospinal tract. What is the reticulospinal tract? Have you ever heard about it? Maybe it will come from reticular side to the in the spinal cord. Okay, this is just like the corticospinal tract, but the reticular formation would be in the this would be forming the in the reticular region. You remember we were talking about the reticular formation. Remember, yes, the reticular formation that was in the pons and the medullary region. That's why this is giving the innervation over there. From the thalami, it will come from the passing the thalami, and after passing the thalami, this will be giving the innervation, giving the path over here, and afterwards it will be coming down. Okay, this way this is coming. So reticulospinal tract is the tract which is giving the second order neuron. Okay, you asked about the second order neuron. The first order would be in this region, which is the thalamus, and the second order would be in this region, which is the reticular nucleus. Okay, so the origin would be from the cortex, and afterwards where it will be going downwards, and what would be the site of like it will it be crossed or not. Actually, from now onwards there are all the tracks which would not cross. Actually, they would cross sometimes, they would not cross. We will discuss that thing, but up till now we say that this will initiate or inactive the movements. Okay, so the function of the reticular formation is to inactivate or inactivate those actions which are not required. Okay, so this is one thing, but starting from that, first we will discuss about the origin, and then we will go on. So what is the origin? Origin is the primary cortex. What about the site of crossing over? Some may cross or some may not. Okay, and what is its destination? Actual destination is alpha and gamma motor neurons. What? Alpha and gamma motor nucleus. What happens afterwards? That what about the branches? How many branches it is giving? It is giving branches to only one area, which we call as the multiple branches of the like they are giving multiple branches as they descend. So they are giving multiple branches as they descend. So it inhibits the functions of muscles if not needed. Okay, this is how they are forming their cells. This is how they are present over there. Now after now you know that corticospinal tracts, what is its function? It is for the rapid movement, but inhibiting the function there is the reticulospinal tract, or we can say there is the reticulospinal tract, which is the one which is inhibiting that, but the activation was by the corticospinal tract. Now there is another pathway which we call as a rubrospinal tract. Rubrospinal tract. So rubrospinal tract tract is the tract which will go to the red nucleus, and red nucleus is present within that of the pons, and here is the thalamus. From the thalamus they are going, and to the red nucleus they are going, and they are coming downwards. Okay, so they are when they will origin soon after the the red nucleus, they will cross over and then they will come downwards. So what is the origin? Primary cortex would be the region, site of the like crossing over as soon as they originate. Afterwards, what would be the destination? Okay, destination would be the alpha and the gamma motor neurons. Actually, what happens is the whole of the descending pathways will have the common destination, as the whole of the ascending pathways had that common pathway as the starting point. They have the final ending point, which is the alpha and motor neurons within that of the spinal cord. Okay, so what would be the branches? It will give none of the branches, because they are directly coming into that of the spinal cord. They are giving none of the branches, so they will activate the flexors but not then inhibit the extensors. You remember extensors and flexors? So they will active the the flexors, and they will inhibit the extensors. This is done. Up to now we discussed that one is rapidly for the movement, which is the corticospinal tract, and the other is the function, or that is inhibiting the function of the nucleus, which is what? Which is the reticulospinal tract. The rubrospinal tract is the one which is activating the flexors and inhibiting the extensors. But the contralateral to that, there is the vestibulospinal tract. Which tract? Vestibulospinal tract. And what it is coming from? It is coming from the same pathway, but actually this is going to the vestibular nucleus. This was what nucleus? Red nucleus. This is the vestibular nucleus. This is present in the medullary region, and from the thalamus it is coming down, and it went downwards, and they are uncrossed. They will not cross within that of the central level, within the spinal cord. They will come as they are, as it is. So they are coming from the primary cortex. The site of this decuscation, they will not cross over. The final destination will be the same, that is alpha gamma motor neurons. And afterwards, the final thing, the branches, they are not giving any branches, but they are flexors are inhibited, and their extensors are, it is innervating the extensors. So if you want to flex, so this pathway will be on. Which one? Rubrospinal. But if you want to extend, then which pathway will be on? Vestibular spinal tract. Vestibular spinal tract, we have also vestibular nucleus is also giving in innervation to the other pathways in the cranial nerves. We will discuss that over there. Okay, up to now you are clear. Now there is an olivary nucleus or olivary pathway. You know there is olivary nucleus. Olivary nucleus is present in the medulla. Olivary pathway. It will go to the. It will go to what? It will go to the olivary nucleus, and from there it will come downwards. And there is the origin is the same, primary cortex, and then we can say that inferior olivary nucleus, it will be present, and in the brainstem, at anywhere it can cross in the brainstem. And what about the destination? Destination is the same, extend alpha and the gamma motor neurons. And what is its actually function? Function is not very clear, so we cannot write it anything. Okay. So up to now we have discussed about how many tracts. We have discussed about the 1, 2, 3, 4, 5 tracks we have been discussing, which are the major tracks within that of the descending tracks. So the corticospinal tract is the most important tract, which is starting from the primary cortex. So actually, they whole are starting from the which tract, from the which part, the primary cortex, and they will going that they would be they have different sites of decussation, and according to their name they are going to their specific nucleus. Rubro means red, they will go to the red nucleus. Vestibular means that they will go to the the vestibular nucleus. They olivary will be going to the inferior olivary nucleus, and then they have the destination is the same, which is the alpha motor nucleus. Alpha gamma motor nucleus are the neurons. Actually, they are their destinations, and they with their branches, they are in the way they are giving these branches. They are not giving if they have a specific nucleus, they will go to the specific nucleus. But as you see, that corticospinal tract, it was going to the internal capsule. So internal capsule is not a specific nucleus, so it can go over there and can give branches over there. But the specific the pathways that are going to the specific nucleus, they are not giving the branches. They are directly coming down, and they are going to the specific parts which they want to be. And their functions, obviously their functions are different. The corticospinal tract have the function of the rapid movements, and the reticulospinal tract, they have the the function of inhibiting the muscles, and the flexors will be activated by the rubrospinal, that is coming from the red nucleus, and the flexors are inhibited by the pathway which we call as the vestibular tract. So are you clear? Any questions up to now? Okay, now we will end these tracks, and we will go through another topic, which is probably the midbrain. So afterwards we will talk about that. So thank you.